Hi, my name is Steve Marpman, and I have Marfan syndrome. I am 49 years old. I live in the greater New York City area, and I was diagnosed when I was 25 years old. I had heard nothing about Marfan syndrome, despite I was a volunteer EMT. I worked a little bit in the medical field in mental health care, and I had heard nothing about Marfan syndrome, connective tissue disorders, or anything like that. However, one day I started to feel very different than I normally feel. I was pretty physically active in my life. I was exercising, working out, doing all kinds of things, and I felt pretty good at age 25. But all of a sudden, I started to feel a little lightheaded. I started to feel very hollow inside, very like an empty feeling deep in my chest. I didn't feel any real pain. I just felt I knew something was wrong. It was, for lack of a better term, an impending sense of doom, a sense of I had no idea what was going on with me. The lightheadedness increased. Fortunately, I was with a friend of mine at home at the time, and I was able to get her to call 911 for me. They had come, 911, and showed up. I actually knew some of the paramedics who came from having worked as a volunteer EMT, and they weren't sure what to necessarily do with me. Was losing color in my skin. My blood pressure was very weak. It was present, it was fast, but it was very, very weak, as if I was losing blood somewhere. And it turned out that I was bleeding internally from a ruptured aneurysm. Learned that later on, though. But in the meanwhile, they tried replenishing fluids. They tried, getting me to be alert in any sense, and it just wasn't working. So I was rushed to the hospital via ambulance. It turns out that I had had a ruptured aortic aneurysm that needed to be repaired, as well as having to replace my aortic valve with a mechanical valve. After that, I had, in subsequent years, I had sustained need for replacing almost the rest of my aorta, my descending and abdominal aorta, as well as my iliac arteries. After my first surgery of having my ascending aorta replaced, I had to change pretty much everything that I had in my life. Everything I thought was set in stone or the path I was on had to change. I was an EMT in a volunteer sense, and I could no longer live patients. I had to learn everything about this illness. I was months away from starting the New York City Police Academy. I thought I was going to do that for a living. That, of course, had to change. That I could do that no longer. All the physical activity I was doing, working out, the kind of exercise, the strenuous building muscle type of activity, someone in their mid-20s wants to do, couldn't do that anymore. And I had to then get used to a different lifestyle, a more sedentary lifestyle, and a different mindset, different career path. I had to get used to medications. I had to get used to taking atenolol, Tenormin, to regulate my blood pressure, because after the first surgery, my ascending aorta, I had learned that I did have dissection running through the rest of my aorta, almost all of it. No aneurysm, but a little bit of a tear inside the lining of the aorta, which I knew one day I would have to have repaired. It wasn't a matter of if, it was just a matter of when. So the medications helped hold things off. Years went by, everything was fine. I changed my life. I changed my lifestyle, my career path. And then about 6 years later, I needed to have my descending and abdominal aorta done all at once. I had gone for regular CAT scans once every year. Everything seemed to be going pretty well, and things seemed fine. But then one year I had my CAT scans done. Everything was great. I was at great measurements. And then one day I was in extreme pain, lower abdominal pain. I thought it was constipation. I thought it was something gastrointestinal. Turns out it was my abdominal aorta. During the CAT scan, it was it was a normal measurement. However, 6 weeks later, it doubled in size. And my abdominal aorta and my descending aorta needed to be replaced all at once. And again, getting used to a lot of changes. I already made a lot of changes in my life, but I had to get used to the recovery. It was a very long recovery. forced me to change careers a little bit more. I had, started working in the mental health field, developmental disabilities field, running group homes. And anybody who's run a group home knows it's more of a lifestyle than than just a job. It's a 24-hour commitment, but I had to modify that. So I started going into home care as a social worker. And getting used to medications, adding losartan at some point to help hold off further dissection and aneurysm. And I still needed to have my iliac arteries replaced because of the work on my abdominal aorta. I had to have I ended up developing hernias, and I had to have hernia repair surgery on a few occasions to repair that. And I unfortunately may need another hernia surgery in the coming months. And it's just been a lot to adjust to, physically as well as mentally, to listening to how my body feels. The knowing that I could have another aneurysm in another part of my aorta that hasn't been replaced, knowing what feels right and doesn't feel right, taking the medications, talking with my doctor, talking with other people with Marfan and hearing their stories, because different people experience aneurysm and dissection differently. So no two people experience this it the same way. I am happy to answer any questions I can that you ask now, or you could post them later through the app. And thank you.